Hello everyone, I am Dr. Azhar Lakhani, orthopedic surgeon at Curis Orthopaedics. Today we'll discuss something, a real patient scenario. There was this child, 11-year-old, he was playing football, had an injury while playing football. Immediately there was some deformity noticed and his father got him to the clinic and we got the x-rays done, and you can see the x-ray now. There was a fracture in the forearm. You can see this bone here, it is fractured and there is some angulation there. Now, whenever we have fractures, we always think that this will require surgery, this will require something which is very invasive. But we should understand that children, they have a very good potential to heal, and most of these fractures, they don't require surgery and they do heal without any surgical intervention. So we discussed the treatment with father. Our main concern was there was some angulation. He wanted to correct that angulation. And one way to correct this is to do it at the clinic itself under local anesthesia. The child was very cooperative. We gave local anesthesia around the fracture site and the angulation was corrected. When we corrected the angulation, we put a cast on top of it, and this is, you can see the x-ray now post the application of a plaster. Now you can still see the fracture, but mainly what we can see is that we have corrected this angulation now. And in this position, we just maintain the plaster and let the bone heal. The child was seen again at the clinic after a month, and we removed the plaster after a month and we took the x-ray. Now if you see the x-ray now, you can see that you can still see the fracture which is still there, but there is a lot of new bone which is forming. So you can see extra bone here, and when you see from the other view, you can see a lot of extra bone forming here. It is very important to understand that healing on the x-ray needs a lot of time. The child will become very comfortable, the pain will not be there, deformity will get corrected. But on x-ray, when we see the images, you can still see the fracture. It doesn't mean that the fracture is not healed. It's in the healing stage. The fracture healing is not very dense, and that's why it is not visible on the x-ray, and you can still see the fracture on the x-ray. And he went about his routine activities. He went to school, he did all his activities. Sporting activities was restricted, and then we saw the child again after 2 months, and you can see how beautifully the fracture has healed. Now the fracture which was visible, it has completely disappeared. The alignment which was altered, it has completely straightened out. So this is what we call remodeling. Children, when they suffer injuries, their fractures remodel very well, and once they remodel, you cannot make out which bone was fractured. And when you see clinically, you can see the function is complete, the hand rotations are complete, the strength is complete, the appearance of right and left hand, this is complete. So this is what we wanted to show, that in children, even with crooked deformities, the fractures heal very nicely. Their outcome is very nice. Most of these injuries don't require surgery, and once healing happens, they are as good as normal. Thank you.